Hi, I'm Dr. Thomas Santucci. We're going to be talking about neurometabolic care. Neurometabolic care is really the combination of functional medicine, a move that began in the 80s where a group of MDs looked at regular diagnosis and decided that, one, it was missing too many things, and two, it just wasn't complete enough. The neurology side is forwarded by the functional neurology group, and that's really the CARIC neurology group. And what we've done is we've merged the metabolic side with the neurologic side to get an advanced diagnostic paradigm. The purpose of this is to go into the complex diseases of modern man and really figure out what's been going on. This started out with the chronic fatigues and the fibromyalgia. And on the chronic fatigues, we're looking at blood chemistry. We're looking at testing at a level that really has been forgotten. When I was in chiropractic college and we were doing this kind of testing, we were looking at 42 lab tests. We're doing about 57 now. But the average blood scan for the average annual physical is doing anywhere from 5 to 10 tests. It just isn't enough. So when we're looking at testing, we're talking about going a step further. We're looking at digestion, we're looking at metabolic rates, we're looking at metals, we're looking at the details between each of the hormonal processes. We may be looking at neurotransmitters, we're definitely looking at DNA. On the neurologic side, the same thing has come to pass. Neurology really is a diagnosis of exclusion these days. If it's not MS, then it's Parkinson's. If it's not Parkinson's, then it's some kind of dementia. What we're doing is we're actually looking at 50 neural pathways to establish how the brain is actually operating, and we're looking for something called functional lesions. And functional lesions means that the tissue is probably okay, but the function isn't okay. And an example of a functional lesion is when my brain is giving a command to my finger to move, that it doesn't move in a smooth, coordinated fashion, and that would be a problem with my cerebellum. You could do a functional MRI and it might look okay, but there would actually be a problem with the brain's transfer of cerebellar function. One of the things that is unfortunate is that most science-based practices are using research that's 20 or 30 years old, and sometimes 40 or 50 years old. In thyroid and autoimmune disease, you really want to keep up with what's going on today. So we're using Cyrex labs and Entero labs to give us the latest DNA information on autoimmunity. What this does is it enables us to understand right away whether there's an attack against brainstem or attack against certain organs. When we're going in and doing the organ-specific analysis, we're looking for this kind of problem. The kind of conditions that neurometabolic work is particularly appropriate for are those conditions that involve more than one organ system. So most of the time there's fatigue, loss of energy, depression, lack of digestion capability, but also general hormonal things like thyroid or sometimes sex hormones or even neurotransmitters. And in most cases, we've got 4 or 5 or 6 things going wrong. If there's a physical or a biochemical thing wrong, there's always a concomitant neurometabolic thing wrong that has something to do with a brain pathway. The brain is always involved. So when we work up a diagnostic paradigm on each individual, we're going to look for all 3 of those things. And in each case, they're going to tie into each other. So conditions that are pretty common that are expressing these kind of problems are chronic fatigue and what used to be called fibromyalgia. Fibromyalgia is really just a natural result of not fixing the brain fatigue. Remember, the brain has to respond to the basic body's impulses and dampen down a lot of signals, including pain signals. When the brain runs out of glucose or oxygen or stimulation, then it just doesn't have enough power to shut that pain down. So we view fibromyalgia as chronic fatigue with a brain-reflected pain. And motion disorders and some of the things that people consider dizziness or vertigo, the actual signals in the brain are actually being sent to the eyes and the body and what's called the vestibular system in an incorrect fashion. It's the collicular mapping or the map in the parietal lobe where the signal is going to the brain in an incorrect fashion and it's being fed to the eyes and therefore balance is off. So very many balance disorders are actually a brain problem. Another thing that can show up as a tic or a change in motion and some of the Parkinsonian kind of behaviors is where the brain thinks you're in one place and tries to put you in another place. So many of the motion disorders are actually the brain perceiving there's a problem and it's compensating for it. So if your head is over to the left, it can be because your brain thought it was over to the right. If you're jerking to one side, it can be because the brain is actually stopping you from the perception of falling. So when we're looking at what conditions are appropriate, again, we want the fatigue conditions, we want the autoimmune conditions, we want the thyroid and the energy conditions, but we also want the motion, the balance, the coordination, and the thinking conditions. So when we talk about thinking conditions, it's a difficult one to talk to people about because a lot of times the very organ that's involved is the one that doesn't work. So cognition, or the ability to think, we're likening to a left brain function, and left brain is the part that can do math operations in your head. But the right brain tells you the deeper meaning, the gestalt of that same operation. So what we want, what we consider good mental health, is that the left brain and the right brain work together in a powerful way, like an orchestra. So your violins and your oboes are actually singing the same song, playing the same piece of music. And so in most people, they've got a dominant side, just like you have a dominant right arm or left arm, and they really aren't paying much attention to the other side. What we need in order to operate the body correctly, or operate the whole physical brain-body complex, is to have the right and the left firing, but also to have the neocortex controlling the more primitive parts of the brain. When that's happening, you not only have balance, you not only have cognition, but you have pain control all wrapped up. One of the things that we're doing differently is that we've put all three parts of the analytical, biochemical, neurologic assessment tools in one place. So we're using advanced technology and advanced methods. There's a lot of schooling involved that's postdoctorate to actually learn how to do this, all in one place. We believe that there needs to be a biochemical metabolic assessment and intervention in most cases. Most people are really running their organ systems in a depleted kind of a way. Neurotransmitter assessments are almost never done in regular medicine, and most people need some help there. So the other thing that we think is that if we can do things at a physical level, we want to intervene there first, biochemical second, and then neurometabolic third in order to get an answer. One of the things that we think is important is to intervene at the physical, the biochemical, and the neuro level, and really going through those three stages. There's things you can do for the brain and for the biochemistry by improving the balance sense, and we're going to go in there first. We're going to improve strength, we're going to improve the function of the brain-body nerve systems. We're also going to improve the biochemistry. And one of the things that was an interesting statistic to me is that people do what the average doctor tells them to do for as long as the prescription medicine lasts. It's about 18 days. One of the things that we do here is we teach you how to run your body. We teach you where your strong points are, what are the things you need to work on, and what are the things that you need to assess on an ongoing basis. After a while, you become in charge because you are aware of what your brain is doing, what your biochemistry is doing, and what your body's doing. The kind of treatment that we're using right now is understanding what are the antigen-antibody responses based on DNA lab testing. To get a thorough metabolic workup is usually going to put the average person in a condition that they have more energy, they're clearer of thought, and they can actually run the physical organ part of their body better. So that is testing, and most of the time it's treatments with natural substances, it's supplements. A lot of times it's a change in diet. Only occasionally is it a prescription medicine, and we work with certain MDs to have that happen. On the physical side, we're using spinal decompression for about a third of our patients. It's amazing how many people are walking around with solvable low back problems. We're using neuropathy treatments that are using the new electro frequencies. We're using low light emission lasers. We have a spine force. We have a 4,000 square foot rehab facility. Beyond that, we really think that much of the healing is done by patient awareness and what you're doing in your daily life. So we train you on 1, how to eat, 2, how to exercise, and 3, how to maximize your potential, given where you're coming from. We treat everything from Olympic athletes to people that are 92 years old that are really worried about just walking. So the range means that we can identify specific treatment plans and work it into what you need. We hold informative workshops on Thursday evenings, and that can range from a series of topics, from everything from autoimmune thyroid to weight loss to fibromyalgia to peripheral neuropathy to balance and coordination. And it seems like it's a big range of subjects, all of which have particular treatment protocols and all of which have their own details, but they all really feature the neurometabolic theme. And that is, in our understanding, health is defined as being a balance between what your brain is doing, your biochemistry, and your physical body. For most people, they've been to 5 or 6 regular doctors and they've gotten partial answers. What we try to do is to do enough testing and enough analysis to try to figure out what's really going on and get you a big head start on what's going on with your solution. I'm Dr. Thomas Santucci. I'm a chiropractor. I'm a certified clinical nutritionist. I'm a functional neurologist. This is the Wellness Pros. We're a neurometabolic clinic in Campbell, California.